European Union is removing the U.S. from its safe travel list as daily cases and hospitalizations rise across America. Amid the surge, an independent CDC advisory board on vaccines is meeting today to discuss the COVID-19 vaccine safety updates and the framework for booster shots. More than 36,000 new cases were reported in the U.S. Sunday, but not all states are reporting their numbers. Last week's 7-day average grew to more than 142,000 cases. That is up nearly 4,000 from the week before. Cases in children are also on the rise, with around 300 children being hospitalized every day. And with school starting up again, with kids under 12 still not approved for the vaccine, some health officials worry it will only get worse. Dr. William Schaffner is a professor of infectious disease at Vanderbilt University Medical Center. He's also a member of the CDC's Advisory Committee on Immunization Practices, which is meeting today on new COVID-19 vaccine safety updates. Dr. Schaffner, thank you so much for joining us. What is the committee voting on today in regard to the now fully approved Pfizer vaccine? And what do you think the outcome of the vote will be?
Well, Tanya, as we speak, they're debating, and I think they will vote, actually, obviously, to endorse the licensure of the vaccine and that the vaccine can be used as previously recommended for all children aged 16 and over. And I think that that will be very exciting and will reinforce the use of this vaccine even more in the United States. I hope even more people accept the use of the vaccine, because we certainly need that in order to control COVID.
And in terms of any updates and recommendations on booster shots coming out of today's meeting, what can you tell us about that?
Yeah, Tanya, I knew you were going to ask, because we're all interested in that, right? At the end of the committee meeting, there will be one presentation that I think will outline a map of where we're going, the kinds of data that will be needed to reinforce recommendations for boosting in different populations. There won't be a vote on that today. I expect that will be coming pretty soon.
So, as you know, many children are starting school if they haven't already, and the vaccine is still not approved for children under 12. I think many parents were hoping by the fall that would be the case. Do you have any updates on the timeline for the approval of a vaccine for children under 12?
Well, we understand all those trials are underway. Obviously, we want good, solid data to show how effective the vaccine is in those younger children, what the appropriate dose is, and the safety considerations. They will come along the end of the fall, the beginning of the winter. In the meantime, what we can do to make schools safe for children is have every adult in the entire community, not just those who are in the school or who have contact with children, but in the entire community be vaccinated. And you know, we can now vaccinate all children 12 and older.
Now, there is still, of course, Doctor, a lot of concern over this Delta variant. With its explosion, hospitalizations are growing across the country. And despite the fact that we do now have easy access to these vaccines and that they appear to be very, very, very helpful in light of COVID, hospitalizations are still higher right now than they were this time last year when there was no vaccine. So what do we need to do to get on the other side of this Delta variant?
Well, I think we need to keep imploring, reassuring people to come forth and be vaccinated. We're going to have to reach very high levels of vaccination, over 80%, in order to really curtail the spread of this virus in our communities. And there are many places in the country, my own state in particular, where we're still way behind. So as many people have come forward for vaccination in the last 2 weeks, I applaud them, but please, we need even more of your friends and neighbors to show up for the vaccine.
All right. Well, Dr. William Schaffner, thank you so much for joining us. We always appreciate your insight.
My pleasure. Thank you.